Hi, I'm Dr. Jim Hoven of Ramos Law and your host of Health Matters. Today, we're going to talk about two of the three primary curves in your spine, and those curves are lordotic curves. Have you ever heard of a lordotic curve? Maybe so. If so, cool. If not, I'm going to show you what they are and how they work next. In our spine, we have three primary curves that allow us to move and to be flexible and to enjoy life at the highest levels. Those curves occur in the neck, the mid-back, and the low back, also known as the cervical, thoracic, and lumbar regions. And those curves have primary names to them. There's one type of curve called a kyphotic curve, which we've done a video about, and there's one called a lordotic curve, which we're going to talk about now. Now, the spine has two lordotic curves and one kyphotic curve. The lordotic curves occur in the neck, where you can see that the point of the curve, the apex, if you will, is toward the front, whereas in the kyphotic curve in the mid-back, the point or the high point, apex of the curve is to the back. So in our spine, when looking at it from the side, we have two, the neck and the low back, lordotic curves. And those lordotic curves are important to keep exactly where they should be so that the spine will have not only the flexibility and the strength, but also so that there's plenty of space for these delicate nerves to transmit all the information from the brain that goes from your brain to your body. What do I mean by that? If we have our lordotic curve in our neck start to move forward, and that happens oftentimes because of posture, because of whiplash or other traumas that we've had in our neck, if that's not corrected over time, all this loss of curve is going to increase muscle tension, it's going to increase joint stress, and that potentially can cause nerve irritation or nerve stress that now leads to pain, headache. The pain is oftentimes in your neck and upper back. It can come into your throat, behind your head. If we lose that curve in our lower back and that low back gets flat, it can lead to pain in the lower back. Also, it can lead to, especially if it gets the nerves irritated, pain into the legs, into the groin, and just really be very, very sore and uncomfortable. So what do we do for these kind of curves? Curves, if they're not a lot of degeneration associated with it, curves can be managed through simple exercises. Now, they're very specific exercises, but simple exercises done every day, which your provider can give you or you can look up online. If you do those regularly, that is going to be huge in protecting your curve. Also, paying attention to your posture, knowing how you're sitting and how you're standing. Are you doing it correctly? Because that will put your curve in the best possible posture that you have for you. Now, if you have a genetic predisposition towards a poor posture, or you've had trauma that is taking you in the way, whether that trauma be a big trauma like a car accident or a fall or a sports injury, or micro trauma, i.e. poor posture over a long time, repetitive use syndromes that take your head forward, something like that. If that's the case, we may need some other things to try to get that neck into place. Things like posture garments that you put on yourself where they're almost like a brace, but it's just a shirt or it's just a pair of shorts that stress your nervous system and tell your body to come back up into the right position. So lots of things that you can do, but the bottom line is you want to keep your lordotic curves in the right shape so that you can be as healthy as possible, especially in your spine. Now, I know there's a lot, so if you have questions about this, please feel free to email me. My email is jim@ramoslaw.com. You can also let me know what else you might want to hear about. If there's other things that you think are interesting or that you'd like to learn, let me know and I'd be happy to give you whatever information I can. Also, if you found this to be helpful, please send it to someone, share it with them so they can learn a little bit more about their spine and how their body works as well. Thank you so much for joining me today for another episode, and always remember, your health matters.